Thank you, Dave. Well, by now, most Western New Yorkers are either eligible for a vaccine or know someone eligible and having trouble getting an appointment.
And that is largely because of the many different locations and methods to try and get a vaccine. But 2 on your side, Steve Brown reports that county governments wish their plans were put in place. He's holding people in power accountable tonight.
The biggest issue with COVID vaccinations in Western New York is there isn't enough vaccine to go around. But, says Governor Andrew Cuomo,
the supply will increase, and we want to be ready when that supply increases.
And counties were ready to carry out mass vaccinations, says Cattaraugus County's public health director.
Absolutely. And we were just ready as soon as the vaccine was ready. But unfortunately, that was not the initial plan.
We have the vaccine.
When the Cuomo administration rolled out its statewide vaccination plan, it largely bypassed plans counties had been working on for months. You see, every county in the country had been required by the federal government to develop a mass vaccination plan, ready to put shots in lots of arms in response to a public health emergency. But when the COVID-19 vaccines were ready, instead of handing over doses to the counties, state government instead set up a system of multiple vaccine pipelines with very strict instructions. Select hospitals playing a primary role, initially ordered to vaccinate essential workers, prioritizing healthcare workers. The state also operating its own vaccination hubs and temporary pop-up clinics to ensure poor and minority communities have access. Pharmacies have just one job: vaccinations for seniors, people 65 and older. County health departments have been limited, ordered to focus only on essential workers, later adding people with health conditions that make them more susceptible to COVID. Instead of leading the vaccination efforts in their counties, local health departments were assigned a supporting role.
So in sum, you were ready for the big game and told that you would be coming in off the bench.
Sounds pretty much that's how I went.
Dr. Watkins is also president of the State Association of County Health Officials. He says his colleagues around the state were also ready to play major roles with vaccinations.
We have been planning for this final piece of this pandemic, and although we were ready, we had to come off the bench, as so to speak, for vaccinating our communities.
Dr. Watkins is not alone here. 2 on your side contacted public health officials for all 8 Western New York counties, all 8, saying if their county mass vaccination plan was fully employed, it would have been effective. Just one example. Erie County's Health Commissioner Dr. Gail Burstein said, "We are very confident in the strength of our vaccination plan. We are ready to scale up our sites and staffing quickly." The state vaccination plan has also raised questions among lawmakers. Example, a bill making its way through the state Senate would require the Cuomo administration to make details of the plan public for all to see.
People want to know. People are looking for answers. We need to be able to give them those answers in the simplest form.
So why did the Cuomo administration pass on existing county vaccination plans to create its own? Well, here's what I learned this afternoon in a phone call with senior health officials on the condition that I not name them. Yes, the Cuomo administration was aware that counties had been preparing mass vaccination plans, but the decision was made to install a regional hub system because it was believed it would be easier for state government to manage. Repeatedly, I was told that the county role in the vaccination plan is a very valuable one and would increase as the amount of vaccine increases coming into New York State. Additionally, I was told that we should look for, in the coming days, more information about vaccinations coming out through the state health department, specifically demographic data. Age, race, and location of people who have been vaccinated, similar to what they're doing currently in the state of Pennsylvania. In Buffalo, Steve Brown, Channel 2 News, Scott and Mary Ellis, back to you.